Welcome to Kitchen Table Conversations, a series of short and shareable conversation starters for those of us who have or love and support people with a complicated and beautiful brain. Here's your host, Angela Geddes.
Hi, and welcome to another edition of Kitchen Table Conversations. It's Angela here, and I'm just so happy that you've chosen to spend some of your day with us here to discuss some important issues and to think about some important issues and to ultimately and hopefully bring them back to your kitchen tables. This has been an interesting summer actually so far, and most of the time summers tend to slow down a little bit. You know, we're all sort of in summer mode, and lots of times the issues that bring us to a therapist, for example, tend to kind of calm down a little bit for some families because we don't have the pressures of the routine and the homework and all the hustle and bustle that goes along with the beginning and the goings on during the school year. However, for many families, summertime presents some additional challenges because there are many people who really do better with a routine and a sense of structure and a team around them to support sometimes just typical developmental needs and other times some real developmental challenges. So today I am going to talk a little bit about some of the ongoing issues that families are facing in an effort to, again, reduce the stigma, increase understanding, and to broaden our audience when it comes to things like the topic of prenatal alcohol exposure and prenatal substance exposure. I think we need to continue to add on to that because there is a lot of emerging evidence that's indicating that marijuana use during pregnancy is not healthy for the development of our babies either. So there's lots of things that we need to consider as with any kind of medication or in fact anything that we choose to ingest during pregnancy. We need to know what kinds of risks are associated with it. So the reason why this is on the forefront for me is because summertime does mean that for many in our culture here in Canada that there's, kind of a relaxed idea or understanding around our alcohol use, and there's a lot more social activities and hopefully lots of opportunity for sunshine and water sports or water play and some beverages for many. And I'm not here to make a judgment around that. I do encourage everyone to look at our, guidelines for healthy alcohol policy and alcohol use, recognizing that we know a lot more about alcohol now than what we used to, and there are some serious risks for those who choose to partake, and also for some serious implications for growing babies. And the evidence is now pretty clear that dads have a role to play in this as well. So I think that's really important to understand that we're really trying hard to reduce the stigma and certainly to reduce blame and shame because I've been in this field for many, many years and I've never seen a parent deliberately harm their growing babies by consuming things that could pose risk to the development. There continues to be a lot of misinformation. So this is the purpose of today's kitchen table conversation is to clarify. September 9th is International FASD Day, and many people take the opportunity to acknowledge the entire month and work towards prevention and increasing awareness. And I think that this is amazing and it's really important, and I think that more and more people are starting to understand that consuming alcohol during pregnancy poses some serious risk. However, what I'm learning in my prevention efforts, in our prevention efforts, is that they're not working. In fact, more people are consuming alcohol during their pregnancy now than they were 10 years ago. So clearly we have to do things differently. And also, I believe wholeheartedly that when asked about alcohol consumption, most people don't consider the weeks before the pregnancy was confirmed. And we now know that this is significant. So in other words, unplanned pregnancies pose an additional risk. And what I'm also seeing is that this message is not being shared or understood as it's intended. And there's a number of different reasons for that. And I think one of them would be, I had a friend say to me, and it can't be that bad. All of our parents drank and we're all fine. And I might have quoted her before, but I'm here to say, define fine for one thing. And not all of our parents consumed alcohol. I can tell you mine did not. She smoked cigarettes because that was the thing. So, I may have a little bit of concentration difficulties as a result of that, potentially. However, alcohol was not a part of my history. So I'm grateful for that because I don't need life to be any harder than what it already is. But alcohol consumption during pregnancy doesn't always result in fetal alcohol spectrum disorder, but there is a direct correlation between alcohol consumption in pregnancy and mental health concerns. And we are in a mental health crisis. We are in a housing crisis. We are seeing many people who are homeless and really desolate and really, really struggling. And that, my friends, is directly related to, in many cases, not all cases, but in many cases, it is directly related to prenatal alcohol consumption during pregnancy. And now I want to be clear that this is not all. We have to make sure that, our messaging is clear. I can't say that alcohol causes all the problems that's happening with people who are struggling with mental health. But I can tell you that 80% of women in childbearing years consume alcohol. I don't know what the stats are for men, but I'm guessing it's around there. And we now know that men play a role, as I just mentioned. So the health of both parents matters when it comes to prenatal health. And we are seeing an increase in mental health conditions. And we are seeing, we talk about it all the time about behaviors of young people. And, we chalk it up to poor parenting and poor decision making, or stubborn little kids, or kids that don't know to follow rules and are so disrespectful. Just got a post yesterday on Facebook talking about how good it was, 40 years ago when parents had a little bit more impact on their kids, and kids were more respectful and they knew how to speak when they walked into a room, et cetera, et cetera. And I feel like our parents are trying just as hard today as they were 30 and 40 years ago to be the best parents they can be. And I think that our kids are trying the best they can to be the best humans that they can be. However, life is complicated right now, and COVID certainly didn't help. And our alcohol culture needs to be examined. And again, the misinformation needs to be examined. So, I've been doing this work for a long, long time, and it surprises me that, on a daily basis, I have conversations with people in my circle who still don't really understand the risks associated with alcohol consumption. And I was even challenged the other day with regards to an individual in my circle who's struggling with mental health and addictions. And this person actually challenged me by saying, so you think that parent drank alcohol? Like, what about that parent? And I'm like, no, I didn't say that at all. This person, experienced some trauma, some family disruption, consumed substances of a variety of sorts early on in their youth and their developmental stages, which definitely plays a role in the development of executive functioning and planning abilities, and it interferes with memory and anger management and affect regulation and overall mental health. So I'm not here to say that everybody's struggling with mental health conditions had a parent who consumed alcohol. But I am here to say that we can prevent a lot from happening by increasing the awareness. So I guess what was puzzling to me is that there was the assumption that anybody that consumes alcohol, even really tiny, small amounts, is going to end up with kids with FASD. And that's not what I'm saying. But what I am saying is that alcohol poses no health benefit to the pregnancy, and it poses a significant risk. And we now know that 2 binge drinks, which is 4 standard drinks within a short period of time, or an evening consuming alcohol, 2 of those within a pregnancy, or more than 7 drinks in a week is enough to meet criteria that could result in fetal alcohol spectrum disorder, which is a significant lifelong condition that affects the brain and the body forever. And it, affects. I had somebody in my session yesterday that, is on an individual education plan since the word go, because math and English are both really, really difficult for her. And they wouldn't have been had there not been alcohol a part of her development. So again, had another conversation about a week ago where we were talking about challenging adolescence and in somebody else's circle. And within 25 minutes, we were able to identify 11 people who were confirmed exposed to alcohol prenatally prior to the pregnancy being confirmed, who are all struggling with puzzling mental health presentations and learning presentations, yet with what I often refer to as pockets of brilliance and some real strengths and some real ability to communicate and to get along well and seem like they understand rules, but yet are not always able to follow them. And I mean, of course, that's typical teenage behavior, but some of these behaviors are not typical, like confabulation or lying about the obvious, and just not learning from mistakes and trying really hard to be the best people they can be, but yet stumbling and being very vulnerable within social circumstances. So I'm bringing this back up as a topic of conversation because I think, again, it's really, really important to clarify some of these myths and misunderstandings and do our best to encourage the healthiest of pregnancies. And when we know better, we can do better. And really and truly, I was just speaking with somebody today who has FASD and who's an adult struggling, but yet with, tremendous strengths and just a beautiful human overall, but struggles with things and wonders why, after 20 years of advocacy, are we still having to have some of these conversations, and why are pregnancies still being exposed to alcohol? I had a conversation again with somebody in my extended circle who, has a baby that has been exposed to moderate amounts of alcohol prior to the pregnancy being confirmed. And since the day of confirmation, there's been no alcohol and only good things, consumed, and the best of healthcare and the best of parenting strategies. And this little person is adorable, but has some vision problems and is quite rigid in her needs and structure and routine, has absolutely no fear of, a lot of things, and is, doing really well in many, many areas. But there are some concerns around attention and around mood and clinginess and, again, just strict routines and that kind of stuff. So, but at 2 or 3 years old or 4 years old, these behaviors are quite within the realm of, the variances often found within developmental stages. So nothing really obvious, but the effects of alcohol and substances during pregnancy, the gap widens as the expectations increase. So now we've got this baby who's spirited, who's energetic, who's hilarious, who's got no fear, who, is just a real spunk. And now we're going to have another pregnancy that, again, we're not taking precautions prior to planning for a baby. In fact, in one instance, it was like, yeah, well, if it happens, it happens, as she's opening up a can of a cooler or whatever, right? So again, I'm sitting here going, I'm watching this happen, and I am wondering how collectively we can send these messages in a more direct but yet still a compassionate way, and not blaming. Like, these are not people who don't care. These are people who are so smart and so kind and such hard workers and so dedicated to being the best parents that they can possibly be. But yet, for whatever reason, the message has not been clear around the fact that there's no safe amount, no safe time, and no safe type of alcohol that can be consumed during the entire pregnancy, even in those very early weeks. Messages are constantly being shared that are inaccurate. In fact, a recent Time article talked about prohibition and the effects of alcohol, over communities. And actually, there's some documentation that alcohol became more difficult to access once prohibition was lifted. So, I mean, there's a lot of controversy or conversation or healthy debate that needs to take place around limiting access and that kind of thing. However, it's very clear that alcohol on every corner and easy access to it does increase the risks of adverse outcomes. But in this article, it talks about the effects of alcohol on a pregnancy, but it's still using dated information and inaccurate and outdated statistics. So it talks here about, 10% of women globally still drinking while pregnant, which is not true. It's a little bit more than that. And it quotes about 119,000 babies annually are born with fetal alcohol syndrome. Now, here in Canada and most places globally, we don't use fetal alcohol syndrome anymore because fetal alcohol syndrome speaks only to individuals who have facial features and physical anomalies, such as low birth weight, and etc. But we know that affects only less than 10% of people who have fetal alcohol spectrum disorder. So now fetal alcohol spectrum disorder is a diagnostic term that encompasses everyone who's been impacted significantly by prenatal alcohol exposure, where a comprehensive multidisciplinary assessment of the brain domains clearly indicate that in at least 3 out of 10 of those domains, there are significant difficulties that are lifelong and that are developmental in nature. So again, these statistics here are inaccurate, but this is in a Time magazine. So this is why, 119,000 babies is a lot, but we've got to multiply that by, 90% more than that is what's really accurate when we talk about the prevalence rates of fetal alcohol spectrum disorder. And then we've got to talk about the fact that our diagnostic capacity is so low that most people who have FASD and would qualify for the full diagnosis will never know it. And then we have to consider the individuals who are struggling with depression and anxiety and maybe a slight speech impediment, or maybe they struggle a little bit more in some topic areas in school or subject areas, in school that is directly related to prenatal health, but we don't even consider it. So again, thanks so much for tuning in. I hope to heck that this goes back to your kitchen table and we work together to help spread the message, to clarify things, and to do our best to prevent a developmental disability that affects more people than any other developmental disability. I am so proud to say that I had a family member say to me just the other day, "You are making a difference, and you really are." And it brings me to tears right now because I do know that I have a lovely family member who's planning a pregnancy and who has chosen to not drink anything at all for a few months, actually, to really make sure that her pregnancy can be as healthy as it can be. So, yay. Have a wonderful day, everyone. Thanks for tuning in. Angela.